All right, we're going to go ahead and get started. We would like to welcome everyone. This is a webinar on adverse childhood experiences and trauma-informed care. This webinar is part of the monthly North Carolina APEX Practice Support Services Lunch and Learn webinar series. These webinars are held the last Wednesday of every month from 12 to 12:30. A quick reminder for everyone to please mute themselves. There will be some time at the end of today's webinar for questions and comments. For now, we would like to hand it off to Jennifer Whitley.
Thank you, Danielle. Good afternoon, everyone. I'm Jennifer Whitley. I'm the manager of Behavioral Health Continuing Professional Development at SAMHSA, and I'm also a licensed clinical mental health counselor associate and see clients in Wilmington. And first, I just want to say thank you to Practice Support for asking me to do this today. And I really would like for today to be interactive. So if you have any questions, comments, please use the chat function and, just type in your questions or comments, and please interrupt me and we will we'll get to those. And I also would like today to be interactive in that I'm going to ask you some questions and I would like for you to respond. We're going to use Poll Everywhere to do this. So I just really first wanted to get a feel for who is here today. So for Poll Everywhere, you're going to text Jennifer Witt 734 to the number 22333, and that will enroll you, and then you can just respond with your answer. So hopefully all of you can see a screen, but if you're just dialing in on phone or whatnot, I understand if you can't participate. But otherwise, if you're an MD or CO advanced practitioner, you would submit A, RN, CNAs would be B, other medical office staff C, social worker D, behavioral health clinician E, and other would be F. We should start seeing some responses come through. Okay, so a lot of social workers, other, RNs and CNAs, okay, so it looks like we have a pretty good mix of folks. And then next question would be your workplace setting. Where do you currently work? Sort of hospital or medical facility, medical or dental office, mental health practice, community agency, public health, or other. All right, looks like we've got quite a few folks in the hospital, medical facility, and public health, some mental health practices, community agencies, and other. All right, thank you for doing that. And last one for now, what population do you serve? Adults, children, adolescents, seniors, a special population like pregnant women or substance use or combination? Okay, so pretty evenly divided here as well. Okay. And a lot of you seeing a combination of those. All right, thank you for taking the time to do that. So our objectives for today, by the time we're finished, you guys should be able to identify the different types of ACEs and their impact on behavioral and health outcomes. Name 2 screening instruments for identifying trauma. List 3 principles of trauma-informed care, and describe the benefits of trauma-informed care. Before we get started, I just wanted to give a disclosure to you all. It is not unusual for people to be triggered of past traumas when we're discussing ACEs, or adverse childhood events. So I've listed some resources here. If you do find yourself triggered, first know that you're not alone in that. And then these are just a few resources that you could reach out to if you feel like you need it. And then you could also, of course, just check with the behavioral health care provider in your community for those needs as well. So adverse childhood experiences, or more commonly known as ACEs, are traumatic experiences that occur prior to your 18th birthday. ACEs are very common. Approximately 60% of adults report having at least one ACE. About 1 in 6 people report having 4 or more ACEs. ACEs do not discriminate. They target people of all races, socioeconomic statuses, religion, political affiliations, but they are more prevalent in some populations, particularly in women and minorities. And ACEs are linked to health outcomes, both behavioral health and physical health. And ACEs can also be very costly. It's estimated that several hundred billions, that's billion with a B, of dollars are spent every year due to ACEs. The ACE study was conducted back in 1995. It went on from 1995 to 1997, and perhaps that's why they call it the most important public health experiment you've never heard of, because it was conducted so long ago, but it's just really gaining notoriety in recent years, particularly on the East Coast. It's been more well-known on the West Coast for a little while now. And it was a collaboration between Kaiser Permanente and the CDC. A little bit of background on that. There was a physician who was running an obesity clinic for Kaiser Permanente in California, and he recognized that 50% of his participants were dropping out, even though they were losing weight. And he wanted to find out why, so he began interviewing these folks and found out that almost all of them had experienced childhood sexual abuse. So he got in contact with Dr. Robert Anda from the CDC, who had also discovered some links between childhood trauma and healthcare outcomes. And so they decided to do this study. And the study was conducted, it was over 17,000 participants, and they were all Kaiser Permanente, they were all in the Kaiser Permanente healthcare plan. And they were primarily middle-aged, middle-class, educated white Americans. They all had good jobs and good health insurance. And the traumas that they measured in this study were 10 different types of ACEs within 3 categories. So in the category of abuse, they measured physical, emotional, and sexual abuse. Neglect was physical and emotional, and then household dysfunction. So what had they experienced as a result of their home. So family member with mental illness, or who was incarcerated, who had substance abuse issues, parents who were divorced, and then domestic violence. So their mother was treated violently in the home. And again, these are all things that occur prior to the age of 18. This is an example of an ACE screening. And again, it asks prior to your 18th birthday. They're very simple yes or no questions. And for every yes response, that it calculates 1 point. So I'm going to invite you all to take this ACE questionnaire and find your ACE score. And then we're going to collect that data on the next screen. Again, this is confidential. I'm not asking you which of these you have a yes response to. I just want to know your number. And when giving an ACE screening, that's a more effective way of doing it. People are more likely to be honest if they don't have to share the specifics. So just take a few moments, read over the questions. For every yes response, calculate 1 point, and then we'll collect the data in just a few minutes. Okay, take about 1 more minute, and then we're going to move on. Okay, so we're going to use Poll Everywhere one more time. So if you would send your answer to the text for Poll Everywhere. So if your A score was 0, you're going to send A. Your A score is 1B, 2C, 3D, and 4 or more would be E. Okay, and so then this is the ACE study that was conducted back in the 90s. And so it looks like some things are still coming in, but overall, it's pretty close between you guys and the original study. Let's see. All right, looks like everybody has submitted now. So about 30% of you, 0, 30%, 1. I guess that's maybe 10% had 2, 20%, 3, and then another 10% for 4 or more. So what does that mean? These are the risk outcomes that the study found. They found a very strong link between the number of ACEs and unhealthy behaviors and the prevalence of physical and mental health issues. So what that translates to in real life, we'll take you guys as an example. So 10% of you had 4 or more ACEs. So what that means is for you, 10% with 4 or more ACEs, when compared with your colleagues who have 0 ACEs, you have a 240% greater risk of having hepatitis, 390% more likely to have COPD, 240% higher risk of developing a sexually transmitted disease, twice as likely to be a smoker, 12 times more likely to attempt suicide, 7 times more likely to be an alcoholic, 10 times more likely to inject street drugs. You're more likely to be violent, to have multiple marriages. You have more prescription drugs, higher rates of depression, higher rates of autoimmune disease, and more absences from work. So that's how that translates into real life. And there is a very high possibility that the people you are serving, knowing these statistics and the outcomes, very high possibility the people that you are serving have at least 1 ACE, if not more. And this graphic shows the ACE pyramid, and it's really just depicts how ACEs impact the entire lifespan. It impacts the risk for disease, health and social well-being throughout the lifespan from conception up to death. And it shows how adverse childhood experiences are really built on the historical trauma and social conditions. And more recently, there has been an ACE study that has added a few adverse childhood experiences to that original list of 10. And these are related to those social and historical conditions. So they include things like racism, an unsafe environment, community violence, food insecurity, and the numbers are the same, that these events certainly impact the outcome of health, physical and mental health. So now that we've talked about ACEs and trauma and the impact of those on health outcomes, does anything about that surprise you? Or is there any questions, comments? You can use the chat function if you'd like to respond? No surprises? Okay, thank you, Sherry. All right, so now that we know about ACEs, what are we supposed to do about it? I mean, clearly there's not a thing in the world that you or I can do to go back and change what happened to someone as a child. Surely there are things that we can do to prevent ACEs from occurring now for children. But that's a conversation for another day. We don't have enough time here to talk about that. But there are things that we can do for those people who did experience childhood trauma and are now adults experiencing these multiple health issues or mental health issues. And that part of that is trauma-informed care. So trauma-informed care really asks the question, what happened to you? It doesn't focus on what's wrong with you. It seeks out a complete picture of the person, their individuality, their past and their present that has made them who they are, and uses that to provide comprehensive and effective health services to them. The implementation of trauma-informed care, it benefits both the patient and the provider. It can aid in earlier identification of those patients at risk for chronic illness. When you know that someone has 5 ACEs, then you know that they're predisposed to have other health issues, and maybe you can get a jump start on those and help mitigate some of those negative health outcomes. Trauma-informed care also increases patient engagement, and because of that, it improves their outcomes. When patients are engaged and are committed to their treatment, then you're going to obviously experience better outcomes. And it also, we talked about how expensive ACEs can be, so trauma-informed care also mitigates some of that and results in decreased costs for both healthcare and social services sectors. SAMHSA, which is the Substance Abuse and Mental Health Services Administration, has identified 4 R's of trauma, making it very easy to remember. And so the first is realize, to realize the impact. No one is immune to ACEs. We've talked about that, and it's safe to assume that the people you're working with on a regular basis, both your clients and patients and your staff, it's safe to assume that they have at least one ACE, and just being aware of that. Recognizing the signs and symptoms of trauma. Trauma is not limited to the behavioral health setting. You're going to encounter people who have trauma in all aspects of life. And so trauma screening can help us assist with recognizing that trauma, but also workforce development, training your staff to recognize those signs of trauma so they can be more aware of that. Respond by integrating trauma-informed practices into your organization. So, and this includes staff in every part of the organization, from the people who greet your patients at the door all the way up to the governing board of your organization. Implementing these trauma-informed practices and really just making it comprehensive across the entire organization. And then resisting re-traumatization is so important when working with folks who have experienced trauma. And there are things you may not be aware of, that how your organizational practices can trigger past traumas. For example, right now with the COVID situation, a lot of places are requiring folks to wear masks. You go to get your hair done and you have to wear a mask. You go to Costco, you go to the doctor's office. And I mean, that's completely understandable with what we're living in right now. However, for someone who was sexually assaulted and had their nose and mouth covered during the assault, they might be triggered by putting on a mask. And so recognizing the impact of the policies that are having on people, and how can you work around some of that to better serve them. And when implementing trauma-informed care, there's a few principles that you want to consider. So clearly, safety is very important to someone who's experienced trauma, not just the physical safety, but also their emotional safety. Are you providing a judgment-free zone for them? Trustworthiness and transparency. Are you clearly communicating with why you're doing what you're doing? Are you maintaining boundaries, providing empathy? Peer support. giving that person the support system they need to be their best self. Empowering your client by giving them a voice and a choice. Engage them in the decision-making for their treatment planning, giving them a choice of what they're going to do, and really promoting that self-advocacy piece that's so important for survivors of trauma. Collaboration and mutuality, getting rid of that power differential that's so common between a provider and patient, and just leveling out that imbalance. Ask your client for permission, invite their input. These are all simple things that you can do and make their experience better and then their outcomes better. And then also consider the cultural, historical, and gender issues that exist. Being sensitive to the unique background that your client has due to these things. When we talk about identifying trauma, clearly identifying the presence of trauma is really integral to trauma-informed care. And you can do this, like we talked about, through universal screenings and assessments. And these are available to aid you in identification of trauma, and we'll talk about some specific ones in just a moment. The provider really has to be prepared to respond appropriately to trauma. So if you give the ACE screen, for example, to a patient and they say, oh yeah, my ACE score is 7, then you need to be prepared to do something about that. You need to be familiar with the resources in your area, who in your area specifically treats trauma, and how can you refer that person to the appropriate source. And also be aware that clients often feel shame, denial. There may be some secrecy associated with their traumatic history, and they may not always answer very honestly. So 2 things you can do to help address that are letting them know that they're not alone. Sharing some of those statistics with them, that 60% of people have had at least one ACE. It will help to reduce some of the stigma associated with that, but also make these trauma screenings part of your everyday practice. You know, every time your patient comes in, or at least once a year, you do blood pressure, or you do an intake, or whatever sector you're serving in, you do these things yearly. So addressing those things on a regular basis, maybe the first or second time they don't answer honestly, but maybe the third time they do, and they finally acknowledge and share that they do have some of these things. So for screening tools, this is just a small sample. This is by no means an exhaustive list. I encourage you to check some of these out, get familiar with them, and see what you might want to implement in your practice, what might be appropriate for you and the population you serve. And then the implementation domain. So trauma-informed care really has to be implemented throughout all the domains of your organization, from the governance and leadership. So your board of directors, your mission statement. Does your mission statement reflect that you have trauma-informed care? Are you engaging and involving all the people who need to be? What screening and assessment and treatment services do you have? How are you measuring that you're being successful? How do you measure that your clients do feel safe, that they do feel empowered? The financing, which is a really important piece. Do you have funds budgeted for these screenings, for the policies, for the extra time it's going to take? Do you have funds that you can budget for continuing professional development for your staff so that they can be aware of trauma and how to provide trauma-informed care? And I'm running out of time, so I'm just going to flow through some of these. So moving forward, if you're interested in learning more about trauma and particularly adverse childhood experiences, I can load some information on your CHEC course. So you registered for this course through CHEC. If you can log on to your AHEC account and access this course, I will put some handouts there for you. One of those will be the full original ACEs study. So if you're interested, you can read over that. There's also some really good handouts for talking with clients and patients. So there's an English and Spanish version. I can load those for you. Also, there's a film, if you haven't seen it, I really encourage you to check it out. It's a documentary called Resilience, the Biology of Stress and the Science of Hope. It a 1-hour documentary, and it delves into the ACE study. And CHEC actually has a copy of that, and we were showing that and doing discussions prior to COVID. Hopefully we'll be able to resume that again soon. If you're interested in having that shown to your organization, to your staff, we're happy to do that. You can just send me an email, and I will be happy to get that scheduled for you. SAMHSA has a pretty inclusive guide of implementing a trauma-informed approach. You can access that on their website. CHEC has some additional trainings on trauma-informed care. You can find those on our website. And then the Center for Healthcare Strategies also has a trauma-informed care resource center that you can check out for more information. And we just have a few minutes left. If anyone has any questions, you can use the chat box to ask those, or comments, discussion. All right, so here's the references used in today's presentation. And then here's my contact information. Again, if you want to talk offline, please feel free to shoot me an email. I'm working from home in the current situation, so my office number, you will not reach me at the moment. And then if you would like to set up a screening of the resilience film for your staff, you can reach out to me about that as well.
Thanks, Jennifer.
Thank you. I hope everyone has a great rest of the day, rest of the week.
Yes, and thank you all for joining. As Jennifer said, a link will be sent with a survey within the next few days from CHEC. Your feedback is very valuable to us. We will also send instructions about accessing the slides for today's presentation, and also the documents that Jennifer mentioned as well. Please note that continuing education credit was not offered for today's webinar. And if you don't already follow North Carolina AHEC Practice Support, you can look us up on Facebook or Twitter, or check out our webpage at ncahec.net. Thank you all again for your participation. I hope everyone has a wonderful afternoon.
Thank you, you too.
Thank you.